Teresa Freed with Johnson County Government. It's our goal to stop the spread of COVID-19 in our community. We also want to make sure you have the latest information on our efforts. For data on how COVID-19 is impacting the county, visit our dashboard on jocogov.org.
At the beginning, the antibodies that we had when we talked about this a few months ago were just not good enough to use. Really, you have to have an antibody test which is 99.9% specific and sensitive. That means its accuracy is extremely high for it to be able to tell you anything about what's going on in the community. These tests still remain to be best to be used in the vaccine trials after there's been a known exposure to the coronavirus proteins to see if there's an antibody response. That's what they were actually developed for in the first place. Or if you have someone who had a symptomatic disease who we think had COVID early on but was unable to obtain the nasal swab at the time, that will give us more information. There's still an issue about using it in the community. If you test a lot of people who are asymptomatic and you don't know whether they're positive or not in terms of their nasal swab, you're going to still see a fairly high percentage of false positives in those tests, even with the very strongly accurate or highly accurate tests. So the answer is simply that we use it either to see the response to vaccine, or whether people have developed immunity after known infection or highly suspicious infection. If you had a person that had a cough or shortness of breath or low oxygen with a high fever, but for some reason they hadn't been able to get nasal swabs or any of the other tests, then the antibody tests would be a way to look at it after the fact. The big problem with using antibody tests is that they don't really tell us what we need to know to control the virus. By the time you do the antibody test, let's say we were going to try and use it for control efforts. Well, the problem is that you don't respond in terms of coming up on your antibodies. The earliest that your antibodies increase after exposure is 14 days. So by the time you have an antibody response, then your incubation period has already passed and you have been out spreading the virus. If you didn't know that you were positive and you weren't quarantining, that you would have been 14 days positive for, at least 14 days positive for the virus, and out there in the community spreading it around without knowing that, because your antibodies will never be positive less than 14 days after you got infected. So it doesn't really help us in the same way that the antigen tests via the nasal or even the saliva swabs that are coming up. It doesn't help us in the same way to prevent transmission.
For more information about COVID-19 in Johnson County, visit jocogov.org/coronavirus. You can also subscribe to a daily e-newsletter with the latest data and precautions being taken in the county and state.